facing low sperm count issues and wondering why it happens, sit back and watch this video. Today I will explain the reasons behind it: stress, age, genetic disorder, anatomical abnormalities, hormone imbalances, and even varicocele can be a cause of low sperm count. But today in this video, I will specially discuss the primary factors that behind the oligospermia. They are indigestion issues, poor lifestyle and unhealthy dietary habits. But before that, understand this, it is very important to find the root cause of your low sperm count so that corrective measures can be taken in time to tackle it. So let's begin. So first problem gonna be indigestion or similar health issues can cause low sperm count mainly because of disruption of intestine function, in which include IBS, colitis, which lead to malabsorption or nutrition deficiency and even inflammation when problems of indigestion and intestinal inflammation develop. Our body ability to absorb essential nutrition gets affected, which is essential for overall health. Sperm production is included in that condition. So therefore, inflammation bowel disease like colitis is one of the primary factors for low sperm count. Have you ever wondered about the symptoms of colitis? Most of the patients are not even aware of that. Constant stool or dealing with constipation for a long time are a few symptoms of colitis. Both can affect our bowel system and its function and overall sperm count also. Even while consulting, I have seen several oligospermia patients face this common problem, colitis. Most patients complaining about issues such as diarrhea, constipation, which is one of the significant factors for stomach related issues such as indigestion and the intestine inflammation, which leads to malabsorption and nutrition deficiency and low sperm count. So due to colitis occur because the body's metabolic activities weakens to transmit energy to our entire body. When our body cannot derive energy from the food we consume, colitis forms in our intestine, which can be troublesome places. Even in Ayurveda, a 7-stage process like of energy in explained called as dhatu parinama, which states that energy needs for sperm count. So production reaches at the 7th stage, the last stage. Therefore, if our body is going through nutrition deficiency due to indigestion problem, then the required energy for sperm production decrease and leading to low sperm count, and that cause oligospermia. Therefore, if you have been neglecting any digestive issues for a long time, get it checked as soon as possible. And another reason for a low sperm count is a lifestyle disorder problems such as hypertension, obesity, diabetes, poor eating habits, drug abuse and lack of physical activity can become a factor for low sperm count, as ultimately such lifestyle choices can cause nutrition deficiency, disrupt hormone levels and impact the normal functioning of the reproductive system. If your lifestyle is inactive or you don't move around much or indulge in physical activities, and with that daily you are dealing with a lot of pressure of stress, then this is might be one of the factors behind your low sperm count condition also, and which is creating you in a oligospermia stage. Therefore, my recommendation to everyone is just adopt a healthier lifestyle habits. This can be done by maintaining a balanced diet and indulging in regular exercise, practicing stress management, and when necessary, avoiding bad habits such as smoking or drug abuse. Just by doing this, you can improve your fertility and alleviate any negative impact on sperm count. The third primary factor is a diet, and the most important part of our life. If our diet does not provide sufficient energy, antioxidants or lack of essential nutrition, it can lead to sperm count. And even eating the same type of food every day creates resistance over time. Therefore, it is essential to maintain a well balanced diet that is rich in nutrition such as fruits, fibers, green vegetable, lentils, lean protein and healthy fat that will support our sperm production process, overall reproductive health also. So what have we learned today? To improve our sperm count, one should focus on these three aspects. First is indigestion issue, second to maintain a healthy lifestyle, and third is to follow a balanced diet. So therefore my advice to you all is always ensure that all these aspects are first checked and understood, so that the complete cause of low sperm count is identified for a permanent solution. If you are still have any confusion or any query related to your oligospermia, you can call me on the number below, consult my team and take a right solution. See you in the next video with the new topic. Till then, take care and goodbye. Namaste.